Are you ready to embrace aging with vitality and purpose? Welcome to Essential Wellness. I'm your host, Dr. Mikel Segal. Let's dive in. Hi, everyone. Welcome. I'm really excited to introduce our guest for today. Her name is Dr. Nishi Bhopal. She's a psychiatrist and she has an expertise in sleep medicine, and just very looking forward to our conversation today. So welcome, Nishi.
Oh, thanks so much for having me. I'm excited to dive into this topic. I love talking about sleep.
Awesome. So maybe just start by sharing with the listeners a little bit about your background and how you ended up doing what you're doing today.
Well, as you mentioned, I'm a psychiatrist by training, and when I went into my psychiatry residency, I just noticed that a lot of my patients were struggling with sleep, and we know that about 90% of patients with psychiatric conditions have some kind of a sleep disorder. And then personally, I was one of those students when I was in college that was just always sleepy. I was always sleepy. I was always tired. I couldn't get up for my 8 a.m. classes. I felt like I just couldn't get a handle on it. So I had a personal interest in sleep, and then that professional interest came about when I was working with patients during residency. And at that time, one of my senior residents was going into a sleep fellowship. And I
Mm,
didn't even know that was a thing. I was like, oh, you can do that? Like, that's a specialty? I had no idea. This was, about over 10 years ago now. And so
yeah.
that just piqued my interest. And I started doing some electives and rotations with the sleep center at Henry Ford Hospital in Detroit, Michigan. That's where I did my residency. And
Mm,
I just loved it because it's so multifactorial, like it involves every system. There's biology, there's psychology, there's social aspects to it, there's lifestyle aspects to it. So I just found it really fascinating. And that's how I ended up doing a sleep medicine fellowship. And then along the way, I got really interested in integrative medicine, in wellness. I was dealing with my own burnout and
mhm.
discovered yoga, meditation, Ayurveda. And so I started doing coursework in that as well after my formal training. And so now that's what I do. So I kind of blend all of these different elements into supporting people with improving their sleep and getting off of sleeping pills because, sleep deprivation is an epidemic. There's a lot of
Yeah.
prescribing of sleeping pills. Yet sleep is a skill that a lot of us didn't learn. And so I
Mhm.
really love helping people, optimize their sleep quality without relying on external things like sleeping pills.
Yeah. Yeah. I know it's true. People automatically, when they think they can't sleep, they're thinking about like, what can I take to help me sleep? That's, I think, what most people kind of go to right away. So just teaching people that there are other ways to go about fixing your sleep. And so, what aspect of sleep do you think is the hardest for people to kind of learn about or to kind of make changes, would you say?
Yeah, well, I think the first thing is just understanding how sleep works. There's
Hmm.
a lot of misconceptions out there. There's a lot of information these days actually about sleep that
Hmm.
wasn't even available. We didn't have social media, to the extent that we have now, 10 or 15 years ago. So there's this explosion of information online, and some of it is good and some of it is not so good or not so helpful. So I would say one of the things is that waking up at night is normal
Hmm.
because I see this a lot with my patients that I work with or from colleagues asking me, like, what can I give someone to help them stay asleep across the night?
Hmm.
And the reality is that it's actually totally normal to wake up through the night, and it's thought that that's a safety mechanism. Because if you think about when we were living out in the wilderness and tribes, thousands of years ago, it would be advantageous to wake up in the middle of the night, survey your surroundings, make sure it's safe, make sure there's no predators or invaders, check it out, and then go back to sleep. So it's an inbuilt safety mechanism that we wake up several times throughout the night. And you may or may not be aware of that, but we don't want to try to medicate that away or, take melatonin in high doses or try to supplement that away because it's actually a normal part of our sleep architecture. So I would say that's the first thing is just understanding what normal sleep looks like and how it works before we start trying to find, fixes to improve it.
Yeah, that's a really good point. Yeah, because that is something that people often complain about, waking up, and then obviously some people do have trouble getting back to sleep once they're woken up. So that is, yeah, a very common complaint. What else, like how else do you work with people like when they sort of come in and they have that complaint? How do you proceed?
Sure. So I think, and so just to your point about sometimes people have trouble falling back asleep. So
Hmm.
that's where we want to kind of look under the hood to see what's going on. Is this a normal event that's happening that you're waking up throughout the night? Or is it associated with frustration or anxiety? Is it being caused by low blood sugar? Is it being caused by hormonal fluctuations,
Hmm.
perimenopause? Could it be a sign of sleep apnea? So that's where, we try to figure out what else is going on. So when somebody comes to me with a complaint of sleep issues, first questions I ask them are, tell me about your sleep schedule. What does your routine look like? And I don't want to just hear about their nighttime experience, but also what happens during the day. Because
Hmm.
what you do first thing in the morning and how you go throughout your day sets you up for sleep at night. So it has a big impact. So I like to understand fully what's going on. And then, of course, I'm a physician, so I want to make sure there's no medical issues that could be contributing. So those include things like thyroid disorders, even micronutrient deficiencies and insufficiencies. In sleep medicine, we pay particular attention to iron and a marker called ferritin, which is a marker of iron stores in the central nervous system. And we're looking for optimal levels. And something that's often surprising to my physician colleagues is that we're looking for a ferritin level more than 100. So I'll have patients come to me saying that, oh yeah, I got that checked and I was told it was normal and it was like 35. And in sleep medicine, we're like, no, that's way too low. So things like that, we may do sleep studies to make sure there's no sleep apnea or something else that's going on.
Hmm.
And then I work mostly with people who have insomnia. So for that, we're using circadian rhythm interventions to stabilize their body clock. The first line gold standard treatment for insomnia is called CBTI. It's cognitive behavioral therapy for insomnia. In my practice, we blend that with something called ACT, which is acceptance and commitment therapy. So it's a little bit more of a gentle approach because I find that people who have a lot of anxiety or insomnia, they don't want to track their sleep, which is part of CBTI, or they don't want to get out of bed if they're awake in the middle of the night, which is another recommendation from CBTI. So we integrate a little bit more of a gentle, holistic approach with patients in my practice. But really, the way that I look at it is from this holistic lens. I want to know everything that's going on. What are you eating? What's your schedule? When are you exercising? What's going on medically? What medications are you on? Can we minimize sleep aids or supplements or things like that that you might be taking? And
Hmm.
really help people feel empowered so that when they do have sleep issues again down the line, which likely they will, because that's just how the nervous system reacts, they'll know what to do and they won't feel helpless or afraid.
Yeah. Okay, I want to go back to just the ferritin point because a ferritin of 100 in women, especially who are menstruating, is very challenging. And it's unusual to see unless there's some like, high iron intakes happening. Would you say?
That's exactly right. So it's
Mm.
rare that I'm getting people to that level, right? So the way that I think about it is that we are going to try to optimize as much as we can. Like I don't have a ferritin level of 100,
Yeah.
Like it's hard to
I
get
don't
to.
think I've ever had a ferritin of 100.
Right. Yeah. But at least we know what the target is, right? So I'll just give you an example. I have patients who will come in. So there's one patient in particular that I'm thinking of, a woman in this age group, and she was struggling with a lot of restless sleep. So not necessarily restless leg syndrome, which is a type of sleep disorder that we know is associated with ferritin levels less than 100. But
Mhm.
she had restless sleep and some fatigue during the day. And that could be construed as normal,
Mhm.
right? So, like, who isn't tired? We're all
Mhm.
tired. A
Mhm.
lot of us are struggling with sleep. And so, a lot of us live with that kind of experience, and we don't
Mhm.
have to. So, with this patient, she came to me because she wanted to work on that. We did the labs, and, I think her ferritin was, you know, 16, something like this, which is pretty, you see that a lot in clinical practice. So the goal with her was to get that up to at least, I want to get them to at least 50. And if we can get to 75, that's even better. If we can get to 100, that's even better. But let's try to work on it so we can optimize. It may not be perfect, but I'm all about progress over perfection. But these little tweaks can make a big difference. And so with that patient, she did notice that improving her iron levels started to improve her sleep. It wasn't as restless. Of course, that's not the only thing that I'm recommending to her. We're approaching this holistically and looking at other tools as well. But she did start to notice her sleep was a bit better quality, and she had a bit more energy during the day, a bit more mental clarity. So we want to look at all of these little bits and pieces because it's not just about sleep hygiene, right? Like everyone knows about sleep hygiene, but there are these other aspects that are at play.
Yeah, and I love that holistic approach, and also the approach to like, okay, we know 100 is ideal, but let's just, try to make improvements. So, progress over perfection. Okay, I wanted to also ask you about napping and what your approach is to naps or what your thoughts are about naps, because I see a lot of different opinions in the experts out there and just wanted to get your take on things.
Great question. So I am a huge fan of naps.
Hmm.
And the studies do show that a short nap in the afternoon, and I'll explain what that means in a moment, but a short nap in the afternoon actually does improve cognitive performance. It can improve memory. So if you're studying or learning something, a short nap can help you retain that information. It's also very restorative, so it can improve your energy levels for the second half of the day. So what a short nap would look like is 15, 20 minutes. I usually recommend no more than 30 minutes before 3 p.m. for most people. Of course, if your circadian rhythm is different, you're going to need to modify that. But before 3 p.m., up to 30 minutes is great. And you can set your timer, like set an alarm on your phone so that you're not um, going beyond that. Because beyond that, you can actually get into deeper stages of sleep. And that's where people say, well, I take a nap and I feel more tired. And that's
Hmm.
likely because you're going into deeper stages of sleep. And so now you're waking up during that, and now you have sleep inertia and you feel more tired, heavy, and groggy the rest of the day. So keep it to those shorter time periods because then you're not going to go into deep stages of sleep. People will also tell me, well, I don't fall asleep in that, in 10 minutes or 15, 20 minutes. I don't fall asleep. That's okay. You can just lay there, rest, close your eyes, and allow yourself that bit of a break as well, because most of us are on the go all day. When do you have time for a break? And so doing that is like charging your phone, right? So you're just plugging in the battery, plugging in your charger for a little bit to recharge your battery. Now, naps are not recommended for anyone struggling with insomnia. So there's a caveat here. So if you're struggling with insomnia, which is difficulty falling asleep or staying asleep, and that's happening, at least 3 times a week, and it's been going on for months, you don't want to be taking a nap because you can think of a nap as like a snack. It's a sleep snack. So if you have a snack before dinner, you're not going to be as hungry for dinner. So having a nap, if you have insomnia, is like having a big snack, and then you're not going to be hungry for sleep when it's bedtime. So for
Hmm.
insomnia, no naps. Otherwise, naps can be quite helpful. I use them myself as well, if I need a little bit of a recharge. And in fact, a lot of companies have nap rooms in their offices. So Huffington Post, NASA, Google, Ben and Jerry's, like these big companies, they have nap rooms, not because they care so much about the well-being of their employees, right? It's not out of the goodness of their heart, but because they know it actually does have a positive impact on their bottom line and productivity of their employees. So something to consider if you are a napper, there's just be mindful of the time and the duration.
Right. Okay. Good advice. Thank you for that. And I wanted to also go back to the point you made about or discussion about the sleep aids. So, what do you recommend for people in terms of sleep aids? Because people are always asking, well, what can I use to help me go to sleep? And what do you say to people?
Yeah. So the way that I think about sleep aids is they're just that. So they're an adjunct or there's something to help support you. They're not a long-term solution, but they can be really useful short-term. And when I say short-term, I'm talking like 2 weeks or maybe a month, like that kind of time period. So not for years and years on end. So we can think about sleep aids in two big categories. There's the prescription ones, and then there's over-the-counter. So in prescription, we've got different types of sleeping pills, and there's different subcategories within that. But some of the common ones are, things like trazodone, Ambien, Lunesta, those types of medications. Doxepin is another one. Those can be helpful for people if you're using it for support. So, for example, maybe they're going through a big life change, a big stressor. I might use it if patients are going through a loss of employment or a divorce or some other stressor that they need that support for sleep. These are really useful tools. The over-the-counter sleep aids can include things like melatonin, which is a whole other category. I got lots of videos about that on my YouTube channel if anyone wants to learn more. But melatonin is a body clock regulator, so it's good for circadian rhythm issues. Or things like botanicals, lavender, ashwagandha, valerian, these kinds of things. What those do, those botanicals, is they calm the hyperarousal response, so that nervous system activation. They calm that down so you can access your sleep drive and be able to sleep. That's what the prescription sleep aids do as well. They calm down that nervous system hyperactivation, that arousal or that feeling wired, so that you can then access your sleep drive. But if you do find that you're relying on these long term, then we need to see what's going on here. Is this chronic insomnia that needs to be treated with the gold standard treatments? Or it's
Mhm.
the sleep apnea that's being missed. And it's often missed in women because sleep apnea in women looks like insomnia, looks like depression, looks like anxiety. So we want to make sure that we're not missing something and treating the wrong thing with an inappropriate, sleep aid, because they're not without risks. Even the botanicals, just because something is natural doesn't mean it's safe, is what I always tell patients. So
Yeah.
we want to make sure that we are assessing things fully.
Yeah. Yeah, that's a good point. People think, oh, it's natural. There can't be any harm. But of course, we know there's can be big harm with some of them. Okay, well, thank you. That's a lot of really great information. I'm sure everyone will get a lot of good tips from this discussion. So how can people, or maybe you can share what you're doing now and how people can find out more about what you do if they are curious to learn more.
Well, currently we are running a 6-week insomnia coaching program for adults who are overthinkers and, have that nervous system hyperarousal. It's called Effortless Sleep in 6 weeks. And so I run that with my sleep coach in my practice. And so for anyone who's interested in that, you can follow us at Pacific Integrative Psychiatry. We've got information about that there. And then if you're a clinician or if you're someone who just wants to learn more about sleep and you love the science of sleep, come follow me on YouTube at Intra Balance, INTRA Balance. And I have lots of great guests and different topics all related to sleep. So yeah, come follow me there. And if you're looking for support for your patients, if you are a clinician working with patients and clients with insomnia, we'd love to support them in our program.
Amazing. Well, thank you so much. And we'll definitely share those links in the show notes as well. So is there any sort of last bits of advice you want to share? Anything more that we didn't discuss that you want to um, let the audience know about?
Sure, thank you. Yeah, so I'll leave you with one tip, because one of the questions I get a lot from people is, well, what's one thing that I can do to improve my sleep? So if you're
Mhm.
going to do one thing, what that is to get up out of bed around the same time every day. So within about an hour of the same time every day, and get bright light, ideally by going outside, getting sunlight exposure, even if it's foggy and cloudy, like it's foggy and cloudy right now in the Bay Area where I am. You can still go outside, get that bright light. That stabilizes your circadian rhythm. And if you keep doing that every day for a few weeks, you'll notice that your nighttime sleep will start to stabilize as well.
That's awesome. Yeah, I always share that one too as well. And actually, it's funny because you mentioned being in the Bay Area. So my cousin lives in the Bay Area, and she has this amazing front porch that faces the sun. So we were sitting out in the morning. I said, "Well, this is perfect for you because you can get up, have your coffee, and just sit out and have the sun in your eyes." So she always calls me. She's like, "I'm just sitting out getting my sun exposure first thing in the morning."
I love it. I call it my sun power. And
Yeah.
I do that. I take my glass of water, and because I like to hydrate in the morning too. So take my glass of water, get my dog, we got on the deck, and that's our sun power in the morning. Just 10 minutes, it can make a big difference.
Yeah, and it feels good too, like immediately when you're just out there, just getting the morning light on your face. Love
Yeah.
it. Well, thank you so much. This has been great, and it's really great to chat with you.
Well, thank you for having me.
Thanks so much. All right, bye. That's it for another episode of Essential Wellness. If you are enjoying listening to this podcast, please subscribe, like, and share with others so everyone can find us. See you next time.